It's Wednesday morning. I'm a little bit late, 9:34 it says. 9:30 is the goal. Um, Oklahoma City, I'm sorry about all of your ice problems. I've lived through that. Power outages, trees falling. It really does sound like gunshots throughout your neighborhood. I've listened to all that before. So I hope Oklahoma City is starting to get their power back, and lots of tree work is coming your way. It is cold here. We don't have ice in central Missouri like they did in Oklahoma City. Um, we talked Monday about the MTHFR genetic variant and how that affects your ability to methylate. And it really affects your folic acid levels, folate, L-methylfolate levels, which is brain food, and vitamin B levels. Good morning, Linda. And I mentioned homocysteine. So I did a 4-part class in May about cholesterol and how you should pretty much ignore cholesterol um, and stay off statins. They don't really do anything except give you side effects. So I may expand on that a little bit more, but really the blood test that I did or have done for years to talk about risks of heart disease was homocysteine levels, and I alluded to that on Monday when we talked about MTHFR. So what I'm going to do is expand on why I mentioned homocysteine blood levels. It's an easy blood test to do. I don't know how many doctors, if any, except functional medicine doctors, do homocysteine levels. And this is work from Dr. McCulley, who was a physician at Harvard, and he's also a physician at the VA, at a VA medical center. So he's done a significant amount of research as a pathologist on homocysteine and what homocysteine means for you overall with heart disease. So homocysteine is an amino acid. It is important in sulfur metabolism. It was discovered by an American biochemist named Vincent Duvignard in 1932, and he discovered that this amino acid had one more carbon atom than cysteine. Okay, so that's an important constituent of all proteins, and he gave it the name homocysteine from the Greek homo, which means same. Okay, so homocysteine, similar to cysteine. So an amino acid called cystic oxide was discovered by in 1810 by isolation from bladder stones, and was later shown to contain nitrogen in 1833, and hence the name cysteine. Um, in working with homocysteine and the amino acid methionine, which we've talked about with the skinny shot, he discovered its importance in supporting growth of animals lacking methionine by chemical transformations in the body called transmethylation. And that's what the MTHFR enzyme, methylene tetrahydrofolic acid folate reductase enzyme, does, is methylation. So little was known about homocysteine in human disease until 1962, when cases of the new disease homocysteinuria were discovered among children with mental retardation, dislocated ocular lenses, accelerated growth, osteoporosis, and a tendency to form blood clots in arteries and veins. Blood clots is the reason for heart attacks. Okay? So Dr. McCulley became interested in the possible connection between homocysteine and arteriosclerosis in 1968 through a review of a case of homocysteinuria from a 1933 case that was discovered by pediatricians at the Massachusetts General Hospital where he worked at Harvard. So this case was uncle of a 9-year-old girl with mental retardation, dislocated lenses, and abnormal blood vessels of the skin, diagnosed in 1965. That was reported in the New England Journal of Medicine. The case from 1933, it was a young boy that died of thrombosis of the carotid artery and a massive stroke. And a pathologist named Tracy Mallory found that the arteries were narrowed by arteriosclerosis, similar to changes found in an older male. Okay, so Dr. McCulley read and ran the pertinent literature on this new disease and confirmed the presence of arteriosclerosis in the slides that had survived from the 1933 case, and found that there were plaques scattered throughout the arteries of this child. Okay, so he was able to study the case of a 2-month-old baby boy who had died of this new homocysteinuria disease, or cobalamin C disease, which was characterized by excretion of homocysteine, cystathione, and methylmalonic acid in the urine. Okay, so he realized that this case could shed light on the possible connection between homocysteine and arteriosclerosis. And what he found was an astonishing amount of advanced changes of rapidly progressive arteriosclerosis. Okay, so this enzyme deficiency and the pattern of abnormal metabolism were different from the archival case from 1933, and so he postulated that elevated homocysteine levels produced arteriosclerosis in these children by a direct effect on the cells and the tissues of arteries. So there was no evidence that lipids are deposited in the arteries of these children, and there was no cholesterol found in those arterial plaques of those children. So he did some experiments with rabbits using a similar approach to that of two colleagues from a half-century earlier, and his research group at Mass General Hospital discovered that administration of the pure amino acid homocysteine to these animals produced arterial plaques and thrombosis of veins and arteries. What avoided that was simultaneous administration of vitamin B6 or pyridoxine, and that prevented plaques and thrombosis. Vitamin B6. Okay. Those experiments were repeated unbeknownst to him in 1975 in Japan, and those results were essentially the same in the late 1970s. Okay, so those results were reported in Japanese medical articles. Okay, so these animal experiments from the 1970s led to the formulation of the homocysteine theory of arteriosclerosis in 1975, about the same time that George McGovern, in his Senate committee, 1978, was starting to talk about cholesterol as the reason for arteriosclerosis, hardening the arteries, etc. Okay. Okay. So in animal experiments, the animals deprived of vitamin B6, pyridoxine, were the ones that developed arteriosclerosis. Okay. So because the B vitamins, folic acid, pyridoxine, vitamin B6, cobalamin, vitamin B12 are all involved in normal metabolism, to prevent excessive production of homocysteine, the homocysteine theory of arteriosclerosis implicated deficiencies of these vitamins in human arteriosclerosis, heart attacks, strokes, and then amputations from vascular disease. So it's a big deal. And it's an easy thing to measure. If your homocysteine level is high, you need to change what you're doing. You need to check your MTHFR status, and you probably need to take vitamin B complex. Okay, so the sensitive vitamin B's, folic acid, pyridoxine are destroyed by traditional methods of food processing. So milling of grains, canning, extraction of sugars and oils from whole foods, addition of chemical additives to preserve foods. This theory appeared to explain the large increase in vascular disease in the early and mid 20th century. Okay, there was a decline in mortality from cardiovascular disease beginning in the 1950s when they started adding the synthetic B vitamins to the food supply by fortification of processed foods. So important support for the homocysteine theory was provided by the Framingham Heart Study, which has been going on for 50 some years, showing that deficiencies of B vitamins are widespread in older people, leading to elevation of homocysteine levels and increased risk of plaque formation. Basically, it's not cholesterol; it's homocysteine. Okay, so there's hundreds of studies by lots of investigators worldwide have now proven that elevated homocysteine levels increase the risk for heart disease, stroke, peripheral vascular disease, and they reduce the longevity in diverse populations. So in 1998, the U.S. FDA mandated the addition of folic acid to refined flour, rice, and other grain foods. Okay, that was the first addition to processed foods since niacin, thiamine, riboflavin, and iron were mandated for addition to refined grain foods in 1941. So it was 1998 they decided to add vitamin B's to food. Okay, so one of the rationales and I lived through this, for adding folic acid is the demonstration that deficiency of dietary folic acid is implicated in birth defects such as neural tube defects like anencephaly, okay, for pregnant women. So an additional rationale not officially cited by the FDA was the hope that vascular disease incidence and complications might also be prevented in the U.S. So studies have indeed shown that birth defects have decreased about 19% in the U.S. and 78% in Canada since fortification by folic acid. And we routinely, since the 90s, tell pregnant women to take 400 micrograms of folic acid a day. And if they've had a history of a neural tube defect pregnancy, 600 micrograms of folic acid a day. If you're an MTHFR genetic variant, you have to take a methylated folic acid. So in general, if you don't do the test, take methylated B vitamins. That's available from Q Sciences. So Q Sciences does have methylated vitamin B's in their products. Okay. There was a study from the CDC in Atlanta showing a declining incidence of mortality from stroke. Declining incidence of mortality from stroke that improved in 1998. No change found in the United Kingdom at that same time period where folic acid fortification was not mandated. And so in 2007, a meta-analysis reported in The Lancet concluded that trials yielding significant reduction in blood homocysteine levels from folic acid, pyridoxine, and cobalamin over a 3 to 5 year period produced significant reductions in mortality from stroke. So you need to know, if you're worried about heart disease, check your MTHFR status. It's a blood test, or a cheek swab, or a saliva test. Or have your doctor order a homocysteine level, or get in touch with me and I'll show you how to order your own MTHFR and or homocysteine blood level. Okay? So homocysteine seems to be the issue. It's an amino acid that's produced when proteins are broken down. So a high homocysteine level, it's called homocysteinemia, can contribute to arterial damage and blood clots and blood vessels. And high homocysteine levels usually indicate a deficiency in vitamin B12 or folate. That's the MTHFR connection. So a normal level of homocysteine is less than 15 micromoles per liter. A moderate elevation is 15 to 30. Intermediate elevation is 30 to 100. A severe elevation is greater than 100. So my doctor tried to put me on Lipitor and wouldn't do it. My cholesterol level was 238, but my homocysteine level was normal. And we're going back 10 years when I was 50. So I ignored the advice of a physician to take Lipitor, and I worked more on weight management, intermittent fasting, and eliminating carbohydrates. Okay, my homocysteine levels are normal. If your homocysteine is elevated and you have B12 deficiency, the symptoms are pale skin, weakness, they're all the vague things. Fatigue, tingling sensation in your arms, hands, legs, feet, dizziness, mood changes. Folate deficiency usually causes fatigue, mouth sores, tongue swelling, growth problems. Okay, and then vitamin deficiency anemia kind of overlaps both of those. So if you're anemic on top of that, you get fatigue and muscle weakness, unsteady movements, pale, yellow skin, personality changes, shortness of breath, irregular heartbeat, numbness, tingling, etc., mental confusion, weight loss. So lots of, very vague symptoms. That's why you need a health coach or a functional medicine physician to figure out what's going on with that fatigue. That was the number one complaint when I was practicing, or as a health coach. I'm sick and tired of being sick and tired, fatigue. Okay? If you have a B12, B6, or folate deficiency, you may have elevated homocysteine levels. Other risk factors for elevated homocysteine include thyroid dysfunction, 50% of women over 40, psoriasis, kidney disease. Some medications do it, and yes, the thing you take for GERD impacts your ability to absorb B12 by intrinsic factor through your stomach. So people that are taking GERD medications can affect their B12 absorption. Okay, so the health issues with homocysteinemia, elevated homocysteine, include osteoporosis, bone thinning, loss of bone mass, atherosclerosis, thrombosis, blood clots, heart attacks, venous thrombosis, blood clots in your legs, wherever, heart attacks, coronary artery disease, strokes, dementia, and Alzheimer's disease. So to diagnose your homocysteine level, you just do a blood test. If you can't get your physician to do it, get in touch with me. I'll show you how to get your own homocysteine blood test. So treatment is usually daily vitamin supplements. If you're an MTHFR genetic variant, which is 10-15% of Caucasians, 50% of Latinos, I don't know what would happen if you went to your doctor and said, I want to do an MTHFR genetic test and a homocysteine level. Most of them wouldn't do it. They wouldn't know what you were talking about, and two, they wouldn't understand why you were wanting to do that. So it's simple to do. Send me a message and I'll send you a link how to get an MTHFR and a homocysteine blood test. MTHFR may be not as important as the homocysteine. Just measure your homocysteine on your own. There's a blood test that measures the basics that your doctor does once a year. So a complete blood count, a lipid panel, a metabolic profile, kidney function, liver function, etc., electrolytes for $35. Homocysteine, probably the same amount. So you can check your own blood levels. You just have to order the kit and take it to a lab and have your blood drawn. So homocysteine is the deal. Cholesterol is not the deal. Um, Heart disease is caused by inflammatory changes. There are a lot of supplements you can take to decrease total body inflammation, because the thing that's going to get you and give you chronic illness is inflammatory change. So whatever issue that you're dealing with that causes the inflammation in your body, that's what a health coach does. That's what a functional medicine physician tries to figure out. So hit me up. I'll talk to you Friday at 9:30. We're probably going to expand a little bit on cholesterol, because I continue. I just got lab results from a person whose doctor circled her total cholesterol level at I don't know, 229, and says, "Ooh, that's getting a little high." Well, her HDL was like 95. So the HDL, which is part of the total cholesterol level, was 95. So ideally she'd be over 50. She had like 45 points over that. And so if you took that 45 points over her 220, off of her 229 total cholesterol level, then that physician would have been fine because the cholesterol was under 200. It's not about cholesterol. So homocysteine seems to be the issue. We'll expand on this a little bit more. Heart disease, the #1 killer of Americans and actually worldwide overall. So I'll see you. It's cold. It's not snowing. I hope Oklahoma City starts thawing out, and I hope they don't lose too many trees. I know what it's like. And I'll talk to you Friday at 9:30. You all have a great rest of your day. I'll talk to you later. Bye.